Chances are you or someone you know right now is sick, right? It's all around us. We're hearing the tridemic, right? The doom phase of COVID, RSV, and the flu. Well, the CDC is also warning parents right now and hospitals nationwide that severe cases of strep throat are also surging, potentially becoming deadly. The CDC says cases are rising in places where RSV, the flu, and COVID are already prominent. So far, 2 children in the U.S. have died as a result, 21 children in the U.K. It's a bacterial infection, strepA. It's not usually deadly, but in rare cases, it can move into the bloodstream. So add that to the list of things we've got to worry about. Dr. Monica Gandhi, professor of medicine at University of California, San Francisco, here with us to talk more about it. I had strep as a kid. My kids had strep when they were young. Time and time again, I never really thought it could be deadly.
You know, it usually isn't, but very rarely it essentially causes strep throat, like you just said, or a minor cellulitis. But very rarely it can move into the bloodstream and it can cause what's called toxic shock, where there is a toxin release from the group A strep that can make us really sick. We knew this was possibly going to happen because we've been seeing this on the European continent and also in the UK, where there's these reports of more severe strep. There are probably 2 reasons this is happening. One, we've just not been exposed to a lot of things over the last couple of years. And the second is it could be the strains are related to more severe cases. Luckily, there are things we can do about it, but you're right. This is, a time of just a lot of illness.
Okay, so what do you do about it? What's the symptoms? What's the treatment?
Okay, so to think about how this manifests, it's not upper respiratory symptoms like sneezing, runny nose, cough, none of that. That is all the symptoms of the other 3 viruses. This is a bacteria, and it essentially causes really bad sore throat, so bad that if you look back there, often you can see a white exudate. It can make you feel really feverish, and because it's in the throat, you can have lymph nodes that are swollen around this. And the thing about strep is it's a bacteria. We actually have antibiotics for bacteria. That was our problem with viruses. We don't have a lot of antivirals. We do now, we're getting more, but we don't before. So this is penicillin treated. It's so easy to treat if you're not allergic to penicillin. We use penicillin or azithromycin if you're allergic. And the minute you have that very severe sore throat, there's no other way to get rid of it but antibiotics. Please go in, get tested, and we can hopefully get it to not proceed to more severe illness.
Right, and you've got parents worried about that, and then I just keep hearing about these cases of RSV. Where do things stand? What is the data showing on cases right now with RSV?
The thing about RSV is it has peaked. That doesn't make it better in the sense that it's peaked and it's coming down, but we still have a lot of cases. It peaked in the 3rd week of November, and now all the cases are coming down, but we still have high cases. Remember, RSV is all that runny nose, that really kind of bad cough. It's retraction where the child, you can see, really is having a hard time breathing. Those are all the symptoms of upper respiratory tract infections. Bring your child in if they have a hard time breathing. We have monoclonal antibodies for very severe cases for neonates. We have an antiviral that doesn't work that well, but mostly it's a lot of supportive care. So please bring in your child if you feel they're getting sick.
Yeah, go with the gut instinct, the parental gut instinct, and take them in. Dr. Gandhi, as always, thank you for being with us. Happy holidays to you. Be well. All right.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.